Hi, and welcome to the monthly XR Medical News and Health Edition with Educators in VR. I'm Rachel Darden, your guide into the future of XR, AI, in health and well-being spaces. Every first Wednesday of the month, we connect with innovators who are shaping what care, connection, and human growth looks like in immersive spaces. We're exploring their personal journeys, what fuels their passion, and how XR and AI are making a real difference in health and well being. I'm also the host of Calm Connection every Tuesday in VR chat at 9 p.m. Eastern, and I hope to see you there as well. I want to thank each and every one of you for being here today for this impactful conversation. And always, always, please don't forget to raise your hand and dive into the conversation with us. XR News runs every single Wednesday here in Engage XR. The first Wednesday is XR News with me in the medical and health, excuse me, deep breath. And every third Wednesday is the XR News Innovation Spotlight with Maxwell McGee, Chris Matson, and Tom Furness. Now, these fellows showcase and create fun experiences and is always something to be a part of. Every second and fourth Wednesday, XR News is going to be with Laurel, Karen, and Steph, and they're bringing you all the latest stories from across the metaverse. And I invite you to stay connected with us across all of our social media platforms and our Educators in VR YouTube channel. All the news links and episode resources are posted in the Educators in VR Discord. This show will also be added to the XR News playlist on YouTube so you can rewatch or share it with your community. The XR News series is produced by the beautiful Educators in VR team and powered by an incredible team of volunteers. We are grateful for the generous support of our partners that are including the Reinhardt Foundation, Girls STEAM Institute, iLearn, Virtual World Society, Vertex Forum 3D, Cadets Metaverse, Engage XR, and of course, Bridgemakers. If you or your organization would like to support this work or sponsor an upcoming show, please visit educatorsinvr.com. So, friends, help me welcome today's guest, a very dear friend and a long-standing Educators in VR team member, Dr. José Ferrer Costa. He is an award-winning XR developer and researcher. His path has started as a family physician in Barcelona and is fiercely bringing XR AI technology into public primary care. Hi, Jose. How are you today?
It's like meeting with family again.
We miss you so much. I'm so glad you're here. So, catch us up. How have you been doing? And what's been
Oh,
going on since the past few years?
well, you mean besides still mourning from my time in the metaverse, in outspace, and hanging out with you guys and doing our event in Education in VR? Well, a lot more. It's been really crazy. You know that my really very niche relation with VR in any way was basically Educators in VR. I think it was maybe day 2 when I was using Outspace VR, which was the first social virtual app that I used to be hanging around. And I think I met, I think it was Karen and Laurel on the second day in one of the events, and it started there. I just got involved with them, and little by little, I was going to the events and learning how to help in the events until we decided to start the healthcare team together with team that was there in the time.
Yeah, no, and that's where we first met as well. We used to work on the team together, and I can't remember. I mean, we brought at least a dozen, if not 2 dozen different events together. It was so amazing and so much fun. And it really helped make it feel like a home to me in a community, more so than just showing up and playing a game. So I really appreciate you being a part of my journey.
Thank you. It was a pleasure. You've always been a star since the start. You have a lot of charisma. And look at the pictures. We're doing a lot of. Is it like this kind of shows where you go and then people get surprise want to surprise you with old pictures like this one, like the chakra world.
Hmm. Yeah,
We
and
used
then
to
we
have
also
go on. Sorry.
no, one more time.
We used to have a lot of guests there. It was such a fun world because people would go there to this meditation center. And every time I went there, there was always someone there visiting. That is the best thing when you are a world builder, when people are using the spaces you built for the community.
One of the spaces I still use to this day is the brainwave. I really, really enjoyed that world and your work on it, bringing in the binary sounds. And it's just a place that's calming and beautiful. And like I said, I personally return there quite a bit.
Oh, it's nice. It was a really nice project together with the other three builders that were working together with me there. They are doing
Hmm.
every bit of effort to make us a really nice place for people to enjoy and find some relaxation and well-being, which is basically the main idea that I had for the works I was building there. Oh, look at that! Now it's the artistic side. That was the Carolina Ike virtual
Hmm.
album. You know, she's this amazing virtuosa that she plays the theremin. You know, the theremin is this element, this instrument that you play basically the virtual air, the virtual magnetic field between the antennas. And when I met her music and the instruments, I said, oh, that has everything to do with virtual reality because
Hmm.
it's very ethereal. And so I talked to her. I sent her an email. I didn't know her, of course. She's very famous, but I'm I sent her an email and I said, well, hey, I really like your songs, your music, and I built a couple of words, and I'm using your music just so you know, and if you'd like to come and visit, so that you see and decide whether I can use it or not. And she agreed to come to Outspace VR. She never used VR before, and she
Hmm.
came. And she really loved it because it was in a. I used to build a lot with like sci-fi and alien words, and she was just about to release a new album that was about alien that felt in love with the moon and then come to the moon and then see the earth and visit the earth. Well, there was a whole history about the alien visiting our solar system. And she said, well, I really like that. I really, really like it. And I'm about to do the album release in about a month from now. And maybe we can do it in the metaverse if you build something for it. And I said, yeah, of course, let's do it. That word, and that is the word there, the word for the whole area. And she was playing live with the theremin and filming herself playing at home, wearing the headsets and her avatar playing the virtual 3D theremin that I built. That was a reproduction of her real theremin. But
Hmm.
the big thing there is that she didn't just want one word. She wanted a word for every piece of the song, of the album, because it was a whole history. So I was building 12 words in 1 month. I was not sleeping, but I was
Oh,
so
wow.
frustrated. I was so in love and so excited about the idea that I did that, and it was very interesting. You didn't just listen to the music; you were visiting each word with the music, telling the history about the song that she was playing.
No, I think that's so beautiful. And I think music sometimes is an afterthought here in VR, but it just helps make it more immersive. And then another part that I really enjoy your works here in VR is how many people you actually bring into VR. Like you bring a lot of people who have never thought about it or even coming into VR, XR, but you champion, you bring them in, and I think that's so amazing.
Yeah, no, but that was, I think, one of the biggest events I participate, and I have to thank again a lot of people that was helping me because, of course, we needed a lot of moderators and people helping people because there were 12 words and we had about 600 visitors in the week, which was huge. And many of them, or most of them, came from educators in VR. All the teams are working, all the friends are there, helping to make
Mm-hmm.
this amazing, exciting event. And she was lovely. Carolina, she's a lovely girl and a person, and she was very happy to talk to everyone. And there was a lot of fans that came to the metaverse for the first time because of her, of course.
No, I think that's beautiful. And I hope that you continue on bringing people on and on and on and in. And that's the beautiful thing about being part of educators in VR is that we're touching base with so many people in different fields, and then we inspire them, to become more creative, more immersive, and really push the limits of what XR and AI can do, and helping and healing people.
Yes, totally. That was the main goal with many of my work in the metaverse. And now I'm doing a different way. I'm still trying to bring well-being and take care of people, but in the real world with XR, which is a bit different. And I'm not using the metaverse anymore for what I'm doing.
Hmm.
But in 2021, I brought for the first time an XR project in the public healthcare system in primary care, and it was actually a educational program for the healthcare professionals to teach them about mindfulness and emotion management, trying to reduce the burnout because it was really a huge problem after the COVID pandemic, of course. And after that, my life changed. The management of the hospital took me out of primary care and sent me into the innovation team. And then I'm now 100% managing and developing a research project with XR in real life healthcare system.
No, that's beautiful. And to date, how many people do you think you've helped with your XR and AR technology?
Oh, you want the number? I can find it. Let me look at my computer. I got it. I have all the numbers. That's my life now, doing numbers, bureaucracy and papers. I had, for example, we have these chronic pain management groups in primary care that are led by the
Uh-huh.
psychologist and the physiotherapist, and they do in 8 different centers. So from 2024, we had 72 participants in total in the groups. And now in 2025, we had 145 more. So we are over 200 people since I started the project, which is
That's
a nice
that's
thing to do.
amazing. Congratulations.
Thank you. Thank you. And of course, I always say XR is not the main thing there. It's one tool that I'm giving to the professionals to make their work easier or to get faster to the therapeutic goal. It's not like the treatment is not the XR or the app, it's really the work they do with the patient. But if you want to teach a technique and you want them to visualize what you're explaining, VR is very good for education. Of course, we all know here we are talking educators in VR because VR is great for education. So that's one of the biggest things we do with VR. Oh, look
Yeah,
at
I
that.
totally.
Sorry.
Oh, so tell us more about this particular space.
I don't know if you've been there because this was a space that I built. It was an homage to women's power. It was called the Lilith Room. You know, when I don't know why I saw I knew about Lilith before, but I was reading about Lilith and the first women, and then she was chased away because she didn't want to bend over and obey men, basically. Histories. So what I did there, it was the age of Mid-Journey, and I was creating this beautiful image with different goddesses. And then I added particles and created this beautiful room with a lot of reflection. And then I had two very, very amazing events there with Caitlin Krause. I don't know if you know her. Yeah, of course you do.
Of course. Yes.
Of course you know. And we are very good friends. And she came with me, and we did 2 events there with for women power empowerment. So it was the whole meditation with a lot of music and movement. It was beautiful, really.
No, Caitlin puts on some great experiences. We definitely champion her as hair as well. And oh, is that still part of the same experience, Jose?
No, this is not. This was Cleopatra's boat and her two lovers there in the swimming pool. This was,
Hmm.
I don't know, I was experiment with a lot of models that I really enjoyed building models with Blender. And then I brought them into Unity and I was bringing them in outspace. And with a lot of reflection and particles doing this foam swimming pool. And she was actually a Red Player Me, Cleopatra, and then you had the movements and she was dancing there like a real Cleopatra queen.
So when you're building all these worlds or you're building all these experiences, typically how long can something like that take for you?
Oh, it depends. For the boat was not so long because it was, well, the building of the boat was a long process, but the actual Unity project was quite simple. It was putting together the pieces. But for example, this other one that we see now in the picture, this was a university that I was building.
Uh-huh.
It looks so big from the picture because it's far away. It's a huge world. But there was like, I think it's 60 different rooms inside, and I was building all the furniture. It was like it was a real university campus for someone in Canada, for a medical guy in Canada that wanted to use the metaverse to teach, basically. So this
No,
one took
that's beautiful.
a lot of things and teleporting when you enter and then you teleport to the exactly room. Well, that was a fun building too.
And how many awards have you won for your world building? Because I mean, definitely, I know the Brainwave, you won an award for that, and there were several others, correct?
Yes, yeah. Well, I didn't get so much awards. That's it. I try to forget a lot about the words. I remember more about the people I'm treating now, the patients that get in touch with the VR. But I remember the first one was in spatial, actually. No, not spatial. Sorry, Mona Gallery. There was this.
Oh, okay.
It's still on, I think. I haven't been there for years, but there was this competition. It was a cryptocurrency competition that we had to build like a headquarters for this cryptocurrency company, and I think it's second prize, but it was a very good prize that made me allowed me to buy a very nice computer and build better words after that. And then there was this, yes, the one you mentioned for the SDG competition with
Hmm.
the. There was also one that I participated together with Shushu. It was the rain dance. We got some prize there also, and I think that's it.
Hmm.
I've been getting now prizes for the projects in healthcare, but it's a competition more. Oh, look at that! Now we're going into the real life work. No, there's a lot. There's a
So,
lot. We just spent there for 2 hours. I don't know if
so
you want me.
in this particular image from your work at BSA, it strikes on how diverse these applications are. You've
Exactly.
got people using AR headsets in clinical settings, rehabilitation exercises, and what it looks like some educational scenarios. Can
Yeah.
you walk us through what we're seeing here?
Totally, yeah. I'm basically living my dream job, I think, because I was really getting a lot involved with building experience in VR. But I still love my being a medical doctor and having patients. So, but I was much more passionate about VR at like 4 years ago. I mean, both of them. But I was about to think about leaving the hospital and the work to dedicate to word building or experience building. But because of this first project that's not there in the picture, but the project for the healthcare professionals to reduce burnout, because I got the chance to be transferred into the innovation room and offered this opportunity to work inside the public healthcare system, which is an institution here in Barcelona that's called Badalona Serveis Assistencials. And they have 18 centers. They have primary care, they have a hospital, surgery, an intermediate care center with palliative care patients. They have domiciliary, mental health, pediatrician, and that's why you have so many projects here, like you see in the picture. And because the first one was the project for the professionals, they did try VR for themselves first, in first person. So after that, they came back to me with their own ideas of when VR would help them to treat for the patients. So that's the best part. I'm not creating a project and trying to impose them to the professionals or the clinicians. They are the ones that get in touch first with VR, learn about the potential of VR to help patients, and then they come back with their own ideas of how to improve what they do with this technology. So it's just the perfect scenario. And in that picture, you see the first one on the top left. I think this is one of the, maybe the, I should not say it's my favorite, but it is. It's the cognitive rehabilitation project. Because I'm working with people that has mild cognitive impairment or initial dementia, and they already come to the center. They come from their home twice per week to do memory and attention exercises. And so we decided that we wanted to make it more motivating with the VR experience. But these are older people, like seniors. Some of them are 90, 92 years old. Like this first lady that you see there playing, she's playing augmented reality, the puzzle in mid of the air, but she looks like a gamer. She loves it. And because they're educated people mostly, and they know how to express they gratitude, they come back after using the technology and they say, oh, we are very thankful for your young people. And that's the best part, they call me young, for bringing us this technology, and otherwise we'll never know that that even existed. So it's so touching because they really, it's almost like we're giving them a new sense, because it's not only the visual, the auditive, it's something different that VR does with people, I think. And you can really see that with this population. So this is a very dear project I have now. The one under it is the primary care chronic pain. You see people bending down, and it's amazing because with the physiotherapist, the what we use the XR here is to engage the patients in movement, because most people, a lot of them with chronic pain, they have kinesiophobia. Kinesiophobia is when you are afraid to move because you have an expectation that when you move, you're going to have pain. So what we do here is basically a distraction, but guided by the physiotherapist. They are playing with augmented reality, so they feel safe because they still see the environment, but then there are a lot of games that they have to touch some objects with different colors or whatever we give to them. And then they forget about, it's not that the pain is not there, but they're not focusing their attention on the pain. And they start moving, and then we show them the pictures and the videos, and they say, wow, I really did that. So in the we are rewiring the brain. We are doing a little bit of hacking the brain here with VR, because we are disconnecting the relation they have of movement to pain and rewiring it into movement equals fun, because they have a lot of fun with the movement they're doing, and then it unblocks them. And it's very fun. They're very happy. The one in the middle.
Oh, go ahead.
Go on. No.
Oh no, I was just saying, like, the connection and the immersion and then the play element really brings out for a lot of people, and it's just so amazing how people are scared of the headsets and they're like, oh, I don't want to do this, but then once they're actually in a headset, it's on. Like, it's a game changer for all. I personally have not brought anybody into VR who were like, oh, that's not for me. They're like, oh my gosh. And I can imagine how many like wonderful, like aha and grateful moments that you have.
It is. It's amazing. It's so. It's really. And when you're there with them, so it's people that normally, most of them, maybe 95%, they never even saw a headset before. So it's like something like sci-fi coming out of nowhere in my primary care center, and then suddenly they are happy and playing like child.
No, I totally agree.
So
And you're traveling a lot. Like right now you're in Barcelona, I'm in Vietnam. And so excuse us for the little bit of the glitching because we're so far apart. But you get to travel a lot right now with your work, right?
yeah, well, I've been traveling a lot because that's one of the most important thing I'm doing now. Is I'm advocating and evangelizing the medical community that VR is not just a game. So what I'm trying to do is to present the actual results from the clinical research that I'm doing with all these patients that have good results. But I don't want them to stay in the piloting phase. I want them to be adopted and to collaborate with other institutions in other places and make them believe that it's a very powerful tool for taking care of people. So what I'm trying to do is to go to different medical congresses like geriatrics, the medical pain society, and the pediatrician, mental health. Not only because before I was going to the VR niche
Hmm.
events, but now I'm trying to prioritize the medical general congresses to present the VR, which is still like a very big novelty for them. And that's surprising for me because it's been there for decades, but you have to really make them see the results, the real life results with the patients. That's what we need them to know.
And I want to
That's,
touch on that because
yeah.
one of the things that stands out about your approach is how systematic it is. You're not just saying VR is cool, let's use it. You're building an entire framework to adaptation. So why do you think that, or excuse me, why is that theoretical foundation so critical for XR in healthcare?
I think the adoption in real life after the piloting and research phase is very precarious right now. It's after you stop doing the research, nobody's using the same element that was very good before because you don't have the resources or the time or the will. So that's why I started now a research PhD in the University of the Open University of Barcelona of Catalonia. And what I'm trying to build is a quite pragmatic and simple, or at least a little bit simple tool to help institutions and clinicians to evaluate before they even start a project, what would be the barriers and the facilitators for after the research project and period to really keep using the system. So that's my idea here. And I'm learning a lot about psychology, behavior science, because that's all about it, not only to evaluate, but then to decide what actions to take to make it more realistic. That's the whole idea of my project. I'm trying to finish the first paper to publish, and then I'll be able to explain better.
No, that's great. And keep us in the know about all your projects. I love celebrating you on LinkedIn. I try to share whenever I see something new and fun. And how do you keep the projects going? Like, so the project is done. You've given these tools and these ideas to all these practitioners and to these end users. Do you have follow-ups with them, or do they come back and ask you questions or ask for more improvements later? Like, how does that really look like once you finish a project?
Yeah, well, normally we do a pilot first, like for the cognitive rehabilitation, we did the first year a pilot just to see if it was usable, accepted by the patients and the professionals. And then after that, we try to do a more, a bigger research comparing the same type of intervention with and without VR. So that's what we're doing now with the rehabilitation. We're doing one group with the extra time with VR and another group without the VR. And it's very important that you find people that really enjoy using the technology. And I call them my virtual clinicians. They're not virtual, reality. And I have a lot of heroes around the institution that are very engaged with using it. So they learn how to take care of the headset, how to solve the technical issues. And that makes it possible because of course I cannot be everywhere in any day. Sometimes I'm traveling
Hmm.
the whole day centers, but it's not one hospital. It's 18 centers all around the city. So it's physically impossible to be everywhere at the same time. And I'm really happy that I have a lot of clinicians that are putting on the t-shirt and carrying the flag of VR and XR for taking care of the patients.
Jose, you truly are inspiring. I mean, you inspire me to stay here within educators in VR because I was overwhelmed at first, but I wanted to see if anyone from the audience had any questions or any feedback so far. If you're welcome, just unmute yourself or raise your hand. All right, go ahead. Just unmute yourself and ask away, please.
Okay, yes, I'm unmuted. Yes, well, it was just great to see the career review, Jose, as well as what you're doing now, and you're just, one of my heroes. But what you made me realize is that obvious things. First of all, the metaverse and XR are two different things. XR, people who spend a lot of time in the metaverse think, why aren't there more people in the metaverse? But there's actually people like Jose out in the physical world showing people about XR and applying it right where they are, which is what should be happening. But then when you got onto your ideas now about how to help institutional adoption, it's the same problem as the metaverse. There's nothing in the metaverse to help individuals try it out and usher them in. And similarly, when an institution gets inspired by your stuff, there's nothing at that much bigger scale to help that whole institution take that first step and be ushered into it. And it sounds like that's what you're trying to do. And man, that just, my head just popped on that. So thanks for everything you're doing, and thanks for this event.
Thank you, Tom. Tom,
yeah.
I think everybody here knows Tom. He's a dear friend, one of the oldest friends I have in the metaverse. And we've been doing a lot of things together and meeting in different events. And you also inspired me a lot in pursuing this crazy roller coaster, trying to evangelize people, especially.
Yeah. Well, maybe the metaverse, maybe what you're doing with the physical reality and universities and the metaverse come together. Maybe there'll be enough people at enough medical institutions around the world that they will need to gather together in the metaverse, people from all over the world to share what they're learning and stuff like that. And boy, I'd sure like to be there for that one. So thanks again.
Thank you, Tom.
Anybody else?
Do you have any suggestions or a platform for people to start in with? What's your favorite platform now for telling people where to go if they want to check out social media in VR?
Well, the thing is that I'm not even using VR, the metaverse myself at these times. I'm mostly doing what we're doing in the physical world with VR and XR is very localized use of this technology, but it's not connected to the metaverse. It's not connected to any platform, most of it. Well, none of it is connected.
So do you find your patients are not curious about it after they've gone through your treatment?
They are, but it's interesting because I started in the metaverse and now I'm doing most of the use of XR completely offline. So they are not really the same thing. It's like it's the same technology, it's the same hardware and the wires, but it's very different use cases. It's like using the computer only to write text and the computer to really connect with people in the metaverse. It's the same kind of difference because they don't even think that it's possible because they're not experienced that kind of experience with the XR headset. They are doing, even though they are connected with the headset, but they are not connected to each other. Even when we have, like, for example, we have a experience that with 360-degree videos, they are watching the same video at the same time, but they don't see each other because the headsets are not connected between them.
I could see why you'd have to do that. So that literally as XR was starting to fragment into specialized use cases instead of what we initially thought was going to be the metaverse?
Yes, because yeah, when I was starting with the metaverse, I started my first project with the metaverse in Outspace, the project with the educational project for the healthcare workers. But it was very complicated in healthcare, especially in clinical settings, to have the connection to the internet because of data protection. The Wi-Fi's are very complicated to access. They all block to everything. So if you want to do a specific use case, especially if you're using for patients, if it's for education with the professionals, it's easier. But for patients, it's very complicated to really get approval from ethics committee to have data going around in the metaverse. They don't even trust the headset. Yeah, but the reason why I get so many projects because most of them are offline. I don't even connect the headset to the Wi-Fi. I think Tom wanted to say something.
Yeah, safety is such a huge protocol when working, especially inside of these environments. And I'm working with children, and safety is the main concern. And in some places, they have VR sets that were given to them by Meta, but they don't use them because they're worried about the safety. So I 100% understand that. And Scott, did you have a question? I think. Oh, go ahead, Laurel.
Scott, go ahead.
Oh, thanks for the moment there to get unmuted. I was going back to something you mentioned, Jose, about there being a bit of a gap between the research completion and moving the technology into like a general practice. And I'm wondering, in your experience in the field, like what fosters that? Like, do hospitals move the dial? Is it private donors? Is it government? Like, what takes the research successes and like moves them into general practice in your experience?
For me, the main factor here is the people, the clinicians. They really need to have a good experience doing the research trial, and they really need a very big technical support and training to learn how to deal with the headset, which is the biggest barrier that we find. Because when you finish, or even during the research period, if you leave them alone with the headset and they have one bad experience, someone that was very happy to use it, suddenly they are like blocked and they don't even want to try it again because they felt insecure, they felt that they lost a lot of time. Because we know that the healthcare system is really overwhelmed with work. People are very burnt out, and the clinicians, they have a little bit, especially doctors, they have a little bit of resistance to learning new techniques and technologies because they are a little bit conservative in the way they do things. So if you're trying to teach them to use this new tool, you really have to make it easier as possible for them to learn how to do it. So in the beginning, you need to be there like always, and always available. If they have a problem, they have to call you, you go there until they really get acquainted with this new piece of technology that they had to learn how to use it. So if you have the clinicians, the one that are actually using the headset with the patient on board, that's key, because then they will fight for it with you. Because the management, they could say, well, the costs are one problem, you have to give them good results for the management to decide that it's going to keep going. But it's mainly the clinicians is the main area that you can find to keep adopting the technology after the research.
You got to make a cadre of more Jose's.
Yes, we need to
Yeah.
clone
I
you.
agree. I agree.
Yeah, it's
Well,
and Laurel?
yeah, but more and more people are doing that. Yes.
yes, they are. They are, and we're Educators in VR is one of them, one of the groups. First of all, thank you for being here. It's what an international tribute to the joy of the metaverse, which is Jose is in Barcelona. I think you're in Barcelona right now. You hop around a few places, and Rachel is in Vietnam. And so it explains a little of the audio issues, but also how wonderful it is that they're here, and we have this ability here to connect. Very different from the medical world, where in the medical world you have individuals need to deal with their individual problems and things. But what I really want to do is you know, in about 20 or 30, 40 years from now, you're going to be looking back as an old man and literally in 50, 60. Let's hype it up further. And you were here, you were involved in the birth of XR technology, metaverse, whatever name we want to put it on, in the earliest days, you know, the baby days, you know, where we were stick figure avatars going on. And then without this being in your career path, you're now deep diving and managing all the medical aspect of XR and the therapies and treatments. What I haven't heard is, what if you had all the money, all the freedom, what project would you do in the future? What would you be doing with all of this knowledge and experience?
Well, I would build a army of horses, of little doctors, excited with the technology, and I would start in the universities. And that is like last week we did a session in psychology university, and the students, even though they were young people, they never tried VR before, and they were so excited. And then after we explained to them first the theory of what VR is being used for healthcare and the scientific evidence behind it, which is growing, as you can see in the picture behind us now. The amount of publications about the use of XR in healthcare is exponential. Every 5 years, you see it's growing, but the adoption is not. It's not going the same way. But they were so excited, and then after they try the headset and they see the actual apps that are being used with the patients, and then you ask them, "What do you think about this technology? Do you think it's usable? Do you think it's something that you're gonna be using with your patients?" And 100% of them said yes. So that's where you want to start. You want to start with the young people, try to evangelize them, as I say, and make them see that it's not a game. It's really something that makes a positive impact on the health care that you're giving to the patient.
Absolutely. We just before this event, we had Mount Royal University psychology students. We've been doing this now for 5 or 6 years. Had their special projects on doing, this is their like junior, senior years of a university, and they look at different techniques and things of psychology, different ways of looking at psychology and the therapies and treatments in VR. And we just had dreamscaping. Oh, Tom Nichols, you should have been there. Jose, you would have loved it. But how to use VR to use dreams as therapy combined with VR. And so you're right. I love it. That's a beautiful example. Let's hope we make all your dreams come true.
Let's hope. And I'm sure it's gonna come true, because it's not only my dream. Like everybody here, I suppose, share the same dream, and many others.
For those that want to see the image up here with the graph, you can open up your menu, and it's right there in the middle button where it says share screen, or it looks like a play button, and you can see it right there in front of your face, so you can see the numbers. All right, Rachel, you're muted.
Yes.
Oh, sorry. I'm trying to help with the feedback here. No, I just think it's really great. And however we can champion you, please always keep us involved. I know you're super busy, but you know, me, Laurel, Tom, we're all here to root you on. And I love the success, and you can feel the emotion and the excitement behind it. So I hope we can continue this on with you. It's very exciting.
Thank you.
Can we go to the next slide, please? Oh yeah, my deepest pleasure. So now before we wrap up, can you tell us about how VR Hub at BSA, and what does it mean to have the dedicated XR infrastructure and public health care system? And what is next for your work there?
Well, that's as I said, I'm living the dream. Actually, it's when I go to like last week when I was talking to other medical professionals that are really trying hard in the institutions to have the small project, and they look at me and I'm having like 18 different projects, and it's like I'm really spoiled. I have to say, because I'm really happy the management of the institution believes in VR. That was key, because they decide who does what, you know. And especially now that we miss and we lacking a lot of doctors, having a medical doctor only managing projects is a luxury in public healthcare system. So what we do have now is external collaboration. I'm starting to outsource what we have been doing to other institutions, still in the public healthcare system in Catalonia. And so I'm bringing, like, for example, now we did a group with chronic pain patients in Tarragona. We're gonna do another one in another area here in Catalonia next year. And the project for the healthcare professional burnout also, we're gonna start using it in different areas. Even the university, the veterinary university, they reached me and they want to use it for the students. So I'm trying to bring what I've been building inside, even though we cannot sell it as a product, it's not a commercial product, but we can make collaboration as a research project. So we use the app for the participants, the patients or students, and then we build even more evidence, because it's going to be the same project with a different population, which is amazing. So this is my next steps. Yes.
No, that's amazing. So how can other people get involved with that? Or is there a space that we can contact you, or a website?
Well, I'm quite available in LinkedIn. I think this first QR code is my LinkedIn, and then, or you can look at Educators in VR and look for me there somewhere in the LinkedIn also. And the other page here is Badalona, is the institution where I work. But it's very easy to get in touch with me with LinkedIn. I'm very available there.
I have just a follow-up question for where you're going. I know, Jose, about a month ago you published a really, peer-reviewed thing in a pretty prestigious thing. Has that got a lot of pickup? Has there been a lot of citations on that, and how's that gone? Because that's another thing. It's not just your evangelizing; it's your publications and those getting read and spread. Yeah.
Yes. Well, that was the second paper that I published with Jamie, because I work with them a lot. I'm a reviewer of articles there. So they are very good. They do a very good peer review process. And I'm very happy with this last project, this last paper about chronic pain. But the first one that I published with them, that was in 2024, and it's about the healthcare professionals burnout project. And it's being cited, like, I think 14 times now. And there is a coming paper that's in peer review process now that I know about, that has been doing a meta-analysis of different projects for healthcare professionals burnout. And our project is very well evaluated in this big review, which I think is better than any prize for me, because it's a very big recognition. I'm very happy with that.
That's it. Yeah, that's what other people say about you. That's great. Yeah. Thanks.
Thank you.
And one of the things I like about your work, Jose, is that the way that you describe it and you put it out there, it's for the common person to be able to read and to understand it. Sometimes I get lost in some of the research papers, but with yours and the way that you word it and put it out there into the universe, it's so highly palatable and easy to understand. So thank you for that as well. I really appreciate it.
Thank you. That's a very good feedback. Yeah, it's important, because you really want people to not only the top scientists and the people that are the academia people to understand what you're doing. You want people, the patients, to understand what you've been doing with them. I did this project now outside the institution because I also do acupuncture. I don't know if you knew that. I've been trained in Chinese traditional medicine, and I had this acupuncture clinic, and I started using VR during the sessions. And I did present it in the Congress, the Medical Acupuncture Congress last month, and we got a prize. And I was showing it to my patients the picture of the prize because they were participating on the project. I'm always thanking the patients because, of course, they are really giving the data and the time for us to learn how this tool works. So I was very happy with that prize. And that was another prize I forgot about.
That is such amazing. I love hearing about your journey. I'm always surprised about how you're being so innovative. And can you kind of just give us a quick run through about your journey before we wrap today up?
Oh, a quick journey. That's very difficult. You mean from the... I've been trying to do that in 1 hour. Now you want me to do it in 1 minute? I don't know. I think I learned a lot about community in the metaverse and collaborating. And that's what I'm trying to do in real life now. It's interesting that I learned that in the metaverse, and I'm bringing it to the medical community now, because it's important to find people with the same kind of mental inclinations, let's say, and dreams. And then you have to start collaborating, helping them to start the little project, whatever they are doing, even if it's not the same one that you're doing and you don't find it that exciting, but you need to help them to start what they want to do. And then that's going to be, everybody's going to win because they're going to make a more evidence that XR is really positive for the healthcare system.
Wow. What a great wrap up. That's just perfect. Yeah.
No, I agree. And I couldn't agree even more. And that's one of you and so many other people in the healthcare and the wellness being space inspired me to host the show, to showcase and to share this with so many people, because it's behind closed doors or, you know, more in these medical spaces. And then here, especially with XR News, we try to highlight it as much as possible. So thank you so much for your work and sharing it with us today. Before we wrap up, did anybody, oh, my pleasure. Did anyone else have anything else to share before we wrap this afternoon up? Well, again, I want to thank each and every one of you for being here today. You guys have been such an amazing audience, and you are the reason we are here. And it's an honor to share this space with you. And each month, a big thank you to Educators in VR for producing this series and championing the medical and health innovation of XR and AI. Please feel free to stay after the show, connect with each other, or connect with me or Dr. Jose. And again, Dr. Jose, he's very active on LinkedIn. So if you want to catch him there, it's Dr. José Ferrer Costa. XR News is a weekly event on Wednesdays. Every second and fourth of the week, Steph, Laurel, and Karen are at the helm bringing the latest news updates. And the third week is our innovative spotlight with the amazing team of Maxwell McGee, Chris Madsen, and Dr. Furness. And I hope to see you back here on the first Wednesday of February. A huge thank you to the XR News crew. We truly could not do this without you. And if you love what we're building here, we're always welcoming new team members. Come be a part of the fun and help us bring these stories to life. Each of our shows are filmed for YouTube, and we'll be adding live streaming to our Educators in VR YouTube channel, Twitch, Discord, and so much more. To stay updated on everything happening across the metaverse, join us on our Educators in VR Discord and social channels. You'll find all the news, updates, and links at educatorsinvr.com. We are deeply, deeply grateful for our partners, sponsors, and supporters who make this work possible. This is including iLearn, the Reinhardt Foundation, Girl STEAM Institute, Virtual World Society, the Cadets Metaverse, Vertex Forum 3D, Bridgemakers, and of course, Engage XR. Thank you again for helping us continue to grow and expand this community. You guys all mean so much to me. So until next time, I'm Rachel Darden, and it has been a pleasure to host this XR News Medical and Health Edition. And I hope to see you in the metaverse real soon. Stands with trees. What do we do? Thanks.
We did a thing!